Hello everyone! I recently received an excellent question from Vicki. Vicki is a team member with Dr. McGee's office, and she brought up a point that we should talk about. When is a patient considered a new patient? Because we all know what a new patient is, but when do you consider them a new patient and actually count them in your stats? Sounds like a simple question, but it's an important detail to clarify. Now, there's a lot of emphasis placed on tracking new patient numbers, and we agree that it's important to maintain accurate stats. But the key word here is accurate. We want to avoid distorting our stats by tracking false or incomplete patient encounters. I'm confident that by reviewing a few different scenarios on this topic, you'll be able to determine when you will count a new patient statistic. Then you'll be able to communicate the guidelines to your team. Alright, so there are 3 different scenarios to consider. First one, a new patient is tallied on your tracking form on the very first visit. So after you've performed the consultation, exam, and x-rays, if you take x-rays, that's a new patient and you count them in your stats. Second, a new patient is tallied on your tracking form on the second visit. So after you've performed consult, exam, x-rays, and the patient returns for their report of findings with a financial commitment, that's a new patient and you count them in your stats. Third, a new patient is tallied on your tracking form on the third visit. So after you've performed consult, exam, x-rays, report of findings, and the patient has actually started a program of care in your office, that's a new patient and you count them in your stats. Many groups and organizations will recommend when to consider a new patient statistic, and if you asked a few of your chiropractic friends, you'd get a variety of answers. Ultimately, you have to determine the best answer to this, and remember to be consistent with how you tally your numbers. Personally, my experience has shown that a new patient is tallied during their second visit, once a report of findings has occurred and they have exchanged a financial commitment. So your action step this week is to determine when a new patient is to be tallied and communicate this to your team. Next, count up all of the visits for the month, and this will give you your monthly new patient numbers. This way it's super easy to form your quarterly and your year-to-date stats. Remember to let your team know your definition so they can follow the proper procedures for tracking your valuable new patients. So let us know what you think about this and click on the comment tab below. Please tweet this, like it on Facebook, or share the link. And thanks for watching. Until next time, we wish you health and happiness. And here's to growing your practice from within.